So the Kiosk project was a collaboration across the whole of Metro North Hospital and Health Service and the Brisbane North PIR Consortia. So in each one of the 3 hospitals, the PIR teams partnered with staff working within the hospital to provide really a group for patients who were in the hospital at the time to access information and learn a bit about referrals and how to access supports once they were discharged from hospital. Part of the aim as well was around supporting the staff within the hospital and health service to learn more about what was available to patients within the community and to upskill them, I guess, around referrals and forward pathways for participants. PIR and the Hospital and Health Service staff delivered it jointly for quite a number of years, and I'm really pleased to say that that's now being delivered within the hospitals solely by the hospital and health staff. So PIR were able to exit, which was the long-term goal. I think the kiosks supported certainly the hospital and health sector. We know that they are under quite a lot of pressure, and that when people are discharged into the community, there's quite a lot of pressure for the staff to support them to link into appropriate services. And so I think that the knowledge PIR were able to share with hospital and health services supported them to be more successful in that role. And also I think it's helped to build relationships, build sustainable relationships across the service sector. And that obviously supports the target population, which was the patients that were in hospital, supports them to have better linkages, better service support around them in the community, and hopefully avoid a readmission into hospital in the future. I think what the kiosk achieved was, well, firstly, we know that it supported hundreds of people whilst we were running the program across the region to access additional information that may not have otherwise been available to them in terms of what was available to them in the community post-discharge. And I think what else it's done is it's provided a model or a framework for community organisations to continue to go into the hospital and reach patients whilst they're in hospital in order to share knowledge and information around new services that might be appearing in the community going forward. I think key learnings from the kiosk for me came from initially there were quite a lot of struggles or clashes of perspective between the hospital and health staff and the Partners in Recovery staff. Partners in Recovery working very much from a recovery perspective. It's very client-led. We go at the pace of the client, and the medical model being quite different to that, it being more prescriptive and sort of got to meet a set of criteria more so. And I think PIR came to understand the pressures of that the staff within the hospital health system are under, and the constraints around the support and care that they provide, and that in turn they were able to understand a little bit more about recovery and recovery focused approaches. And in the end I think we were able to come together and gel really nicely and use the strengths from both our perspectives to better support clients with their onward journey post-discharge from hospital. I think it would be awesome to see the kiosk continue, for them to be an access point for communities to continue to provide in-reach into the hospital, share knowledge, information for patients. I know that there's work going on to continue those relationships between the community sector and the hospital and health system, and both are committed to continuing those relationships. And one of the ways that they're doing that is through the Collaboration in Mind Consortia, where they can all come together and discuss sort of broader community needs to better service our population.